Let's talk about our relationship with alcohol. For a long time, the whole conversation around health and drinking has been, well, a little complicated. Our goal here isn't to preach or to wag a finger. It's to dig into the science, because as it turns out, the way most of us were taught to think about drinking isn't just a little outdated, it's completely broken. You know the question, right? For decades, this was it, the big one. A simple yes or no question for something that's actually super complex. It's the first thing we ask ourselves, or maybe a loved one, or even our doctor. But what if that's the wrong question to begin with? What if the real issue here isn't just about the drinking, but about the thinking? That old black and white model we've all been using, this idea that you're either an alcoholic or you're totally fine with nothing in between, it's that kind of all or nothing thinking that we really need to rethink. I mean, for doctors and patients, this binary model just hasn't been working. It created a world where you didn't really talk about alcohol unless it was a total crisis. And because of that, we've missed countless opportunities to help people much, much earlier. This single number says it all, really. It shows you just how badly that old approach failed. Think about it. For every 8 people who could have used some help, 7 of them were missed entirely. The system was basically designed to only see the most extreme, visible cases, leaving almost everyone else completely invisible. So researchers and doctors came up with a major rethink. And the best way to get it is through this iceberg metaphor. The idea is, we need to stop staring at just the little bit that's visible above the water, because the real story, the much, much bigger story, is happening unseen below the surface. And here's the absolute kicker. The vast majority of health problems related to alcohol, we're talking everything from accidents to chronic diseases, they don't happen to that tiny group we used to label alcoholics. They happen to people whose drinking habits look, from the outside, pretty normal. So this is the new model. It's not a switch, on or off. It's a spectrum. It recognizes that alcohol's impact is a gradient. And most of us, if we drink, fall somewhere along that line, not just at one end or the other. So let's break down what this spectrum, this iceberg, actually looks like. Okay, so the iceberg basically has 3 layers. At the very top, that's the tip you can see. That's where you find severe disorders with really clear life-changing consequences. Then, right below the water, there's that middle layer. These are folks who are starting to see some negative effects, maybe memory lapses, arguments, or the start of health issues. But the base is the biggest part by far. And that's made up of people who are just exceeding the recommended limits, often without noticing any obvious problems, at least not yet. Now, this isn't just a clever theory, it's backed up by some pretty shocking data. When you start to look at the entire iceberg, not just that little tip, the true public health impact of alcohol becomes incredibly clear. Get this, 1 in 3. That's how many visits to the ER are connected to alcohol in some way. And that's everything. Car accidents, falls, fights, even things like heart failure. This isn't some niche problem. It's a massive, massive strain on our whole healthcare system. And that impact can be absolutely deadly. Every single year in the US, 85,000 people die from causes linked directly to alcohol. And again, this isn't just one type of drinker. This number pulls from the entire spectrum of use. And, the risks go way beyond just liver disease or accidents. We now know for a fact that alcohol is linked to 7 different kinds of cancer. And what's really sobering is that for women, the risk of breast cancer starts to go up with even less than 1 drink a day on average. That's the key takeaway here. There's really no level of drinking that is completely risk-free. So, keeping those risks in mind, experts came up with these guidelines. For men, the recommendation is no more than 14 drinks a week, and you want to keep it to 4 or less on any single day. For women, it's half that, 7 a week and no more than 3 in a day. It's best to think of these as guardrails, right? They're there to help you stay in the lower risk part of that spectrum. But what even is 1 drink? This is so important. It's a standard 12-ounce beer, a 5-ounce glass of wine, or a 1.5-ounce shot of liquor. And it is so easy to underestimate this, right? Especially with today's pint glasses or when you're pouring a generous glass of wine at home. Knowing this definition is really the first step to getting an honest picture of your own habits. Okay, so let's make this a little more personal. Health experts talk about this idea of sliding, that slow, almost unnoticeable creep from, say, 1 drink a day to 2, or from 2 to 3. Life gets stressful, habits start to form, and we often justify it by telling ourselves we're still high functioning. But what does that label really mean? This really shows the gap between the stories we tell ourselves and what's actually going on. We think, oh, it helps me sleep, but the science is clear. It messes with your deep sleep. We believe it helps with stress, but it's really not a great long-term strategy. We feel like we're keeping up at work and at home, but our performance is quietly taking a hit. Sometimes high functioning is just another way of saying we've gotten really good at ignoring the consequences. All right, after all that, here is the really hopeful part. Because this bigger, better model of the iceberg, it comes with a much bigger, much more modern toolkit full of solutions. The whole conversation's changing, and so are the options for getting help. And this is probably the most important message of all. Just like everyone's experience with alcohol is different, the way you make a change has to be different too. That old one-size-fits-all approach is officially gone. So instead of just one path, there's now a whole menu of options. It's not just about quitting cold turkey anymore. A first step could be as simple as doing a confidential self-assessment online. Or maybe it's just starting an honest, judgment-free conversation with your doctor. It could even just mean quietly deciding to moderate, like switching from pints to bottles. For others, therapy can give you amazing tools to handle stress without alcohol. The point is, there are so many different pathways to get to a healthier place. And the medical science here has come a long, long way. The old approach sometimes used medications that basically just made you sick if you had a drink. But modern options, like naltrexone, work totally differently. They actually target the reward system in your brain, reducing cravings and making alcohol less pleasurable. This gives people way more control, making it easier to cut back or quit. It's a whole new world of support. And if there's one thing you walk away with, I hope it's this. The barrier to making a positive change is lower than it's ever been. You don't have to hit rock bottom. You don't have to be ready to quit forever. You can see huge benefits just by taking small, deliberate steps in a healthier direction.